Welcome to today's video about 10 morning symptoms that reveal a failing pancreas. Every morning, your body sends you signals. Most are harmless parts of waking up. But what if some symptoms are urgent messages from one of your body's most vital organs? The pancreas, a small gland behind your stomach, works silently to keep you alive. It produces enzymes that digest food and hormones that regulate blood sugar. When it begins to fail, warning signs often appear first thing in the morning, yet most people dismiss them as normal digestive issues. The truth is serious. Pancreatic dysfunction can progress silently for years before diagnosis, and by then, significant damage may already be done. Today, we're examining 10 morning symptoms that could indicate your pancreas is struggling. These aren't random observations, but are backed by medical research and recognized by gastroenterologists worldwide. If you're experiencing several of these symptoms, this video could be the wake-up call that saves your health. Let's begin. All right, here are the morning symptoms that could point to a struggling pancreas. Let's begin with number 1. Unexplained weight loss. You step on the scale one morning and notice you've lost weight without trying. When weight drops without changes to diet or exercise, your body is signaling something is wrong. This is one of the most significant early warning signs of pancreatic failure. Your pancreas produces essential digestive enzymes, lipase, protease, and amylase. These enzymes break down fats, proteins, and carbohydrates so your intestines can absorb them. When your pancreas produces enough enzymes, a condition called exocrine pancreatic insufficiency develops. The food you eat passes through your digestive system without being properly broken down. Your body cannot extract the calories and nutrients it needs, even though you're eating normally. Research from the National Institutes of Health confirms that unexplained weight loss is a hallmark symptom of pancreatic enzyme deficiency. Your body is literally starving at the cellular level, unable to access nutrition in your food. Studies show that patients with exocrine pancreatic insufficiency can lose significant body weight despite maintaining normal eating patterns. This isn't healthy weight loss from lifestyle changes. It's involuntary, often accompanied by muscle wasting, and happens despite normal appetite. If you've lost more than 5% of your body weight over 6 months without trying, and especially if other symptoms on this list sound familiar, your pancreas may be sending a distress signal requiring immediate medical attention. Weight loss combined with other symptoms should never be ignored. Next, symptom 2, greasy, foul-smelling stools. This symptom is uncomfortable to discuss, but is one of the most telling signs of pancreatic failure. If your morning bowel movements have changed in a specific way, pay attention. We're talking about stools that are greasy, oily, pale in color, and have an unusually foul odor, particularly noticeable first thing in the morning or after breakfast. This condition has a medical name, Steatorrhea. It occurs when your pancreas cannot produce enough lipase, the enzyme responsible for breaking down dietary fats. Without sufficient lipase, fats pass through your digestive system largely unchanged. These undigested fats give your stool its characteristic greasy appearance and offensive smell. According to research published in the journal Pancreatology and documented by Stat Pearls, steatorrhea is a defining feature of exocrine pancreatic insufficiency. Medical literature describes these stools as pale, bulky, and malodorous, often floating in the toilet bowl due to their high fat content. The stools may be difficult to flush, leaving an oily film. The pale color happens because bile, which normally gives stool its brown color, isn't properly mixed with digested fats. The smell is particularly distinctive because undigested fats decompose in your intestines. Many people live with this symptom for months or years, assuming it's dietary. However, steatorrhea specifically points to your pancreas's inability to produce adequate digestive enzymes, requiring medical evaluation. Next, symptom 3, frequent bloating and excessive gas. Do you wake up feeling bloated, as if your abdomen is inflated? Does this bloating worsen throughout the morning, accompanied by excessive gas and flatulence? This isn't just normal digestion. It could be your pancreas failing to provide the enzymes your gut needs to process food properly. When pancreatic enzymes are insufficient, food doesn't break down properly. Carbohydrates, proteins, and especially fats remain partially digested as they move through your intestines. These large food particles become food for bacteria in your gut. As bacteria ferment the undigested food, they produce significant amounts of gas. Research published in gastroenterology journals confirms that bloating and excessive gas are common symptoms of exocrine pancreatic insufficiency. The fermentation process creates various gases, including hydrogen, methane, and carbon dioxide, which distend your intestines and cause that tight, swollen feeling. Medical studies have documented the connection between pancreatic insufficiency and small intestinal bacterial overgrowth, which worsens these symptoms. Many people notice their pants feel tighter by mid-morning. The flatulence can be problematic because gases produced from undigested food often have a more offensive odor than normal intestinal gas. While bloating and gas can have many causes, when combined with other symptoms on this list, they point toward pancreatic dysfunction requiring medical evaluation. Studies show pancreatic enzyme replacement therapy can significantly improve these symptoms. Next, symptom 4 is upper abdominal pain in the morning. Pain is your body's most direct alarm system. When it comes to pancreatic failure, the location and timing of pain tell an important story. If you experience abdominal discomfort or pain in your upper abdomen when you wake up or after breakfast, particularly pain that radiates to your back, your pancreas may be inflamed or damaged. The pancreas sits deep in your upper abdomen, behind your stomach and near your spine. When it's inflamed or diseased, a condition known as chronic pancreatitis, the pain typically manifests in the upper central or upper left abdomen. According to the National Institute of Diabetes and Digestive and Kidney Diseases, this pain often has a distinctive quality. Research describes it as pain that may feel like a deep ache radiating straight through to your back. Some describe it as a band of pain wrapping around the upper body. The morning timing is significant. After hours of fasting during sleep, your pancreas is relatively quiet, but when you eat breakfast, your pancreas receives signals to produce and release digestive enzymes. If your pancreas is damaged, this attempted enzyme production can trigger pain. Clinical studies show the inflamed tissue responds with discomfort when asked to work. The pain may start mild and gradually worsen over weeks or months. Some notice it's aggravated by fatty foods requiring more pancreatic enzymes. Next, symptom 5, early satiety and feeling full quickly. Imagine sitting down for breakfast, taking just a few bites, and suddenly feeling completely full, as if you've eaten an enormous meal. Your stomach feels heavy despite having consumed very little food. This sensation, called early satiety, is more than a small appetite. It's a symptom that your digestive system isn't functioning properly, and pancreatic insufficiency is often the culprit. When your pancreas fails to produce adequate digestive enzymes, food sits in your stomach and intestines longer than it should. The normal breakdown process is delayed or incomplete. Without proper enzyme activity, food particles remain large and difficult for your intestines to handle. Your gut responds by sending signals of fullness much earlier than normal. Medical research recognizes this feeling of fullness among symptoms associated with pancreatic enzyme deficiency. The sensation can be particularly pronounced in the morning. Your first meal of the day, which should provide energy, instead leaves you feeling bloated, heavy, and unable to finish even a modest portion. This symptom creates a problematic cycle. Because you feel full quickly, you eat less throughout the day. Combined with malabsorption from enzyme deficiency, your body receives even fewer nutrients, accelerating weight loss and nutritional deficiencies. Some describe feeling like food sits in their stomach, not moving or digesting properly. When eating becomes uncomfortable, people eat less, compounding malnutrition already caused by pancreatic insufficiency. Next, symptom 6, morning fatigue and general weakness. You've slept 8 hours with nothing disturbing your sleep. Yet when your alarm goes off, you feel exhausted. The fatigue isn't grogginess that clears after coffee. It's a deep, persistent weakness that follows you through the morning and often the entire day. If this sounds familiar, your pancreas might be why you can't shake that tired feeling. When your pancreas fails to produce adequate digestive enzymes, your body cannot properly absorb nutrients from food. This includes proteins that build and repair tissues, fats that provide concentrated energy, and fat-soluble vitamins essential for countless bodily functions. Cleveland Clinic research confirms that malabsorption from pancreatic insufficiency leads to chronic fatigue and weakness. Your cells are being starved of the fuel they need to generate energy. Additionally, chronic inflammation in the pancreas itself demands energy, further depleting your reserves. The fatigue from pancreatic failure has specific characteristics documented in medical literature. It's not relieved by rest. It's often accompanied by muscle weakness, making even routine morning activities feel exhausting. You might notice you're too tired to exercise, or that physical activities once easy now leave you breathless and worn out. This isn't depression-related fatigue or poor sleep habits. It's metabolic exhaustion at the cellular level. Your mitochondria aren't receiving the raw materials they need to produce energy efficiently. Studies showed treating the underlying pancreatic insufficiency can significantly improve energy levels. Next, symptom 7, cold intolerance and feeling unusually cold. Do you find yourself shivering in the morning when everyone else seems comfortable? Do you need extra layers, even in moderately cool temperatures? This unusual sensitivity to cold, particularly noticeable when you wake up, might seem unrelated to your pancreas, but there is a direct connection. Your body maintains temperature through metabolic processes requiring adequate nutrition and body fat. When pancreatic insufficiency prevents proper absorption of nutrients, several things happen affecting your ability to stay warm. Cleveland Clinic research indicates that malnutrition from pancreatic disease leads to loss of subcutaneous fat, the layer of insulation beneath your skin. Without this natural insulation, your body loses heat more rapidly. Additionally, metabolic processes that generate heat as a byproduct require adequate calories and nutrients. When malabsorption starves your cells, your metabolic rate may decrease. You produce less metabolic heat naturally. Fat-soluble vitamins, particularly vitamin D, play roles in metabolic regulation. Deficiencies in these vitamins can further impair your body's ability to maintain temperature. People with advanced pancreatic insufficiency often report feeling cold when others aren't, especially in the morning before they've eaten and metabolic activity is at its lowest. They may wear sweaters in warm rooms, use heating pads frequently, or take hot showers just to feel warm. This cold intolerance worsens as malnutrition progresses. While many conditions can cause cold sensitivity, when it appears alongside digestive symptoms, pancreatic dysfunction should be investigated. Next, symptom 8, morning nausea and queasiness after breakfast. You sit down for breakfast, eager to start your day. But within minutes of eating, a wave of nausea washes over you. Your stomach feels queasy, unsettled, and the thought of eating more becomes unappealing. This morning nausea, particularly when occurring after eating, is a troubling symptom many people with pancreatic insufficiency experience, but few recognize as significant. The mechanism behind this nausea relates directly to pancreatic function. When you eat, your body signals your pancreas to release digestive enzymes into your small intestine. If your pancreas is damaged or diseased, it may struggle to produce or release these enzymes effectively. Food enters your digestive system but isn't properly broken down. Your stomach and intestines become distressed by this improperly digested material. Gastroenterology research confirms that pancreatic enzyme deficiency can cause significant digestive upset immediately after eating. The nausea may be accompanied by general digestive discomfort, as if food sits heavily in your stomach. Some also experience intermittent vomiting, though nausea without vomiting is more common. The timing is particularly telling. If nausea consistently occurs in the morning after breakfast rather than randomly throughout the day, it suggests a digestive enzyme issue. Your pancreas has been relatively inactive during sleep, and the sudden demand for enzyme production when you eat breakfast overwhelms its compromised capacity. This symptom often causes people to skip breakfast, which worsens nutritional deficiencies. Next, symptom 9, new on or worsening blood sugar problems. The pancreas has two critical functions. We've been discussing its exocrine function, producing digestive enzymes, but it also has an endocrine function, producing hormones regulating blood sugar, particularly insulin and glucagon. When pancreatic damage progresses, both functions fail. If you're experiencing new onset blood sugar problems, particularly morning hyperglycemia with high blood sugar when you wake, or episodes of hypoglycemia with low blood sugar, your pancreas's endocrine function may be compromised, representing more advanced pancreatic disease. Cleveland Clinic research indicates that when the endocrine pancreas fails, glucose regulation becomes problematic. You may notice symptoms of high blood sugar in the morning, including excessive thirst, frequent urination, blurred vision, or unusual hunger. Alternatively, you might experience hypoglycemia symptoms such as shakiness, confusion, sweating, or extreme hunger, particularly if insulin production is erratic. Morning blood sugar issues are especially common because your body's glucose needs change during sleep and upon waking. Your pancreas must respond to these changing demands with appropriate hormone secretion. When it cannot, blood sugar levels swing unpredictably. Research shows people with chronic pancreatitis eventually develop diabetes specifically from pancreatic damage, a condition called type 3C diabetes or pancreatogenic diabetes. This differs from type 1 and type 2 diabetes because it results from direct pancreatic destruction rather than autoimmune attack or insulin resistance. Studies estimate 25 to 80% of people with chronic pancreatitis develop type 3C diabetes. Next, symptom 10, morning muscle aches, brittle nails, and hair loss. This final symptom might seem most disconnected from your pancreas, but it reveals how malabsorption affects your entire body. If you're waking with unexplained bone or muscle aches, cramps that seem to come from nowhere, noticing your nails have become brittle and break easily, or experiencing hair loss beyond typical shedding, chronic malabsorption from pancreatic insufficiency might be depleting your body of essential nutrients. Your pancreas's failure to produce adequate enzymes doesn't just affect immediate digestion, it creates widespread nutritional deficiencies over time, particularly of fat-soluble vitamins A, D, E, and K, plus essential minerals like calcium, magnesium, and zinc. Cleveland Clinic research confirms these deficiencies manifest in numerous ways throughout your body. Vitamin D and calcium deficiency leads to bone pain, osteoporosis, and increased fracture risk, according to published studies. Magnesium deficiency causes muscle cramps, particularly in the morning after your body has gone hours without food. Vitamin A deficiency affects your skin and hair health. The brittle nails, often with ridges or white spots, indicate multiple mineral deficiencies documented in medical literature. Hair loss beyond normal shedding, particularly hair that's become thin, dry, or breaks easily, reflects protein malabsorption and vitamin deficiencies. Research shows these symptoms develop gradually as nutrient stores deplete over months or years of malabsorption. When these symptoms appear alongside digestive and metabolic symptoms discussed, they complete a clinical picture of systemic pancreatic failure. The pancreas may be small, but its impact on your health is enormous. These 10 morning symptoms, including unexplained weight loss, greasy stools, bloating, upper abdominal pain, early satiety, morning fatigue, cold intolerance, nausea after breakfast, blood sugar dysregulation, and musculoskeletal symptoms with hair and nail changes, form a constellation that points toward pancreatic dysfunction. Remember, experiencing one or two of these symptoms occasionally doesn't necessarily mean pancreatic failure. However, if you're dealing with several of these symptoms regularly, particularly in combination, it's time to take action. Speak with your healthcare provider about pancreatic function testing, which may include fecal elastase tests, blood tests for nutritional deficiencies, imaging studies, or specialized breath tests. Early detection of pancreatic insufficiency matters tremendously. With proper diagnosis, enzyme replacement therapy can dramatically improve digestion, nutrition, and quality of life. Lifestyle modifications, including dietary changes and vitamin supplementation, can address deficiencies and prevent complications. Your body is speaking to you each morning. These symptoms are its language. Don't ignore them. If you found this information valuable and it helped you understand symptoms you've been experiencing, please type "helpful" in the comments below. Your feedback motivates us to create more content that can make a real difference in people's health. Please like this video, share it with anyone who might benefit from this information, and subscribe to our channel for more evidence-based health content. Thank you for watching, and take care of your health.